Welcome to IRG's Health Talk. I'm Tom Hutler along with Shannon O'Kelly, physical therapist and president of IRG Physical and Hand Therapy, and our guest, Dr. Scott Van Appledorn from EvergreenHealth and Washington Urology Associates.
Dr. Van Appledorn, how are you doing today?
I'm doing great. How about yourself?
I'm doing great, too. Hey, thanks for joining us here on the radio. I'm quite interested and excited to talk to you about your area of interest because we're just wrapping up the month of November. We all know November is kind of recognized as Men's Health Month. So we're going to talk about testicular cancer, which is one of those things that we all know men just don't talk about their health issues, but it's something we have to talk about. But before we get to that, tell us about your practice and your areas of interest.
Sure. Well, I'm a urologist, so in general terms, urologists specialize in diseases of the urinary tract and genitalia. Oftentimes, we're considered sort of men's health doctors, so we do play a big role in things like testicular cancer, and we take care of a lot of male issues, but we certainly take care of women as well. My particular practice, I do general urology, but I have specialized in cancer care. So I did an oncology fellowship, and so do have specialty training in minimally invasive surgery as well as cancer surgery. So that's definitely something that I take a great interest in and try to help out people with these types of problems.
And that, we often don't think about urologist and cancer because it's kind of an area that I guess is just not on our radar screen, particularly for us guys. But tell us what kind of cancers in urology you would see, because I know testicular cancer is one of them that we're going to kind of dive into, but give us some other examples of some cancers that men need to be aware of.
Absolutely. So urology really is a very cancer-heavy specialty because there are cancers of the testes, which we're going to talk about, penis, urethra, bladder, kidneys, and particularly prostate. So these are organs that have a very high rate of cancer and something that we have to treat very commonly. And we are almost oncologists by training for these organs. And we'll get patients sometimes that say, oh, well, I need to see an oncologist because I have cancer. And certainly we work hand in hand with medical oncologists and radiation oncologists. But we really are the primary, sort of caregivers for sort of low-grade cancers. And certainly testicular cancer is one of them. Prostate cancer, we do a lot of primary treatment for. Bladder cancer. So we are, have to stay well versed in, updates and cancer therapies and treatments. But it's something that, we are almost all oncologists by nature in this specialty of urology.
Yeah, you bring up a really good point about these cancers, and again, we're going to get into testicular cancer, but I do want to ask you a question that I hopefully will benefit all of our male listeners out there, and you deal in this area of men's health, basically. Why is it that men, you just don't see a group of men getting together and having a beer talking about, have you had your prostate checked this year, I mean, we just don't do that. That's an area that men just kind of, do they just naturally stay away from, or is it uncomfortable? I mean, just when you just described all these cancers, I was getting a little bit nervous there.
Oh, well, absolutely. But, men we're taught to be indestructible, right? We don't have problems, or we can solve all our own problems. And, I certainly sort of grew up in a very stoic household where, we don't talk about these things very much. And I'll say my sense is that attitudes are changing. And certainly there are cancer support groups that are sort of breaking down the walls and the barriers here. But I just think it's become more acceptable to acknowledge cancer and acknowledge these problems. And it's amazing to me that nowadays, in the last few years, I'll have patients who are diagnosed, for example, with prostate cancer, and they'll say, gosh, I ended up bringing it up at work, and, 4 guys chipped right in that, I had prostate cancer, and this is how I was treated, and this was the, pros and cons, and this is why I came to that decision. So I think it's getting better, but boy, I still see the guy that, I found this abnormality 4 years ago, and it took me that long to get to a doctor. I mean, that still exists out there, and I'm sure women, do that to some degree, but not to the same. It really is a male problem that we're trying to address. And just like shows today, if we talk more about this and just get the information out there, patients and people will know that it's okay to bring up a problem and get it addressed by a healthcare professional.
Absolutely, and particularly when you're talking about these men's health and these cancers that you were talking about right now, we all know that being the tough guy doesn't pay off, because if it's caught early, the chances of treating it successfully are improved significantly. That's
almost a universal truth, and wishing it away, in my experience, hasn't worked yet. For anybody. And just to be evaluated, and even if nothing's wrong, to have that peace of mind, in my book, makes all kinds of sense.
Okay, here we go. Let's get into the category here, and we're talking about testicular cancer, and obviously it's a cancer of the testes, but maybe kind of what's going on there?
Well, testicular cancer is obviously sort of unregulated growth of the abnormal cells in the testicle, and usually it manifests or it's detected by feeling a lump or growth in the testicle. And lots of other things can mimic that, but usually it's pretty distinctive, and a hard knot or nodule or growth of the testicle, and usually it's detected by the patient by feeling the testicles. Certainly, it's something, if a man's getting a physical examination every year, it's something that should be included in the examination, as having the healthcare provider check for that. But that's usually how it's detected. And by the time patients come to see me, the things that we're interested in are, confirming the diagnosis, and that's often done with imaging tests like an ultrasound of the testicle, as well as some blood tests, which look for, specific abnormalities that can be produced by testicular tumors.
And besides what you just described as essentially self-examination, is there any other symptoms of the lump, besides the lump, that you might palpate? I mean, is there any kind of changes in urinary activity or anything like that?
Not usually. And testicular cancer in advanced stages can spread, all over the place. And so we've had instances where someone will present with a lump in their neck, for example, or some neurologic changes because of metastasis to the brain. That's really uncommon. But the most common scenario is just, I feel a lump. And so those are the things that make us want to get checked out.
Any specific screening guidelines? I mean, particularly, we know it's a gender-specific cancer, obviously, but is there any age or historical or family history, anything that needs to be looked at?
So, screening is a tricky business, as you're probably aware. Screening for all types of cancer, there's controversy, because screening implies that putting everybody through the same types of tests leads to earlier diagnosis, better outcomes, etc. Testicular cancer, very fortunately, is fairly rare, and in the United States, just this year, we'll expect less than 10,000 new cases. Somewhere around 8,800 cases will be diagnosed. And so you think about the population of men in this country, that this is not a high volume type of cancer. So there's really not great data that suggests that, okay, let's line up 1,000 guys here and we'll screen them every so often and just kind of ignore these guys and let them show up when they feel a lump or just picked up by accident. And so there's really no program that says doing one thing or another is better. But what we generally consider for testicular cancer is you should, in your general health screenings, meaning just your regular physical every year, they should include a testicular exam as part of the examination, and if abnormalities found there, follow that up. But it's also advisable, in many patients are recommended to do self-exams, and usually every month is what's recommended. And obviously if there are changes or lumps or something worrisome, to bring that to the attention of the provider. So again, the data wouldn't say, hey, you have to screen this, that, and the other, but common sense will say pay attention to your own body, or have your healthcare provider pay attention to it, and follow up on things that might be abnormal.
Excellent points. So here, this scenario is you've been diagnosed with testicular cancer. Tell us about, from diagnosis to treatment, what are your options?
So usually diagnosis is often suspected by the results of the examination and an ultrasound test.
Okay.
And usually, to get the confirmatory diagnosis, the testicle is removed. And just the natural history of testicular cancer, we don't usually recommend to put a needle into the testicle and take a small sample of tissue. Usually the diagnosis is pretty very highly likely based on the imaging results. So we go ahead and remove the whole testicle. Usually that's a pretty minor surgery, an outpatient type of surgery. We usually leave the other testicle alone unless there are suspicious findings on that testicle, or sometimes a history of an undescended testicle. But generally speaking, the surgery to remove a testicle is not a big deal, and that then allows the pathologist to look at the tumor and to tell us what type of tumor it is. And there are really two categories of primary germ cell testicular cancers, and that is seminoma or non-seminoma. And we treat those a little bit differently based on the follow-up stage and grade that we learn from doing imaging after we've confirmed a diagnosis.
And then the treatment options based on the stages or grade is generally, you talked about removal, but is there always chemo or radiation involved?
Well, there's not. And so the majority of these tumors are sort of low-grade, low-stage type of cancers. And so what that means is we won't see any lymph node spread into the retroperitoneum. So testicular cancers have a tendency to first spread into the lymphatics that drain into the abdomen and to the sort of the back. And so we'll usually do a CAT scan and look to see if there are any lymph nodes enlarged there. And if there are not, then the options for treatment at that point are either to observe, because there's a 70 or 80% chance that there'll never be anything developing there, or depending on risk factors, we can sometimes do low-dose chemotherapy or radiation therapy for seminomas. So there are options, and they're largely based on whether we see lymph nodes present or if there are spread to other organs. But certainly for a large number of people, if there's no obvious spread of the cancer, observation is a very reasonable option. But it does require close surveillance, because even if we don't see anything right away, in the coming months and years, there is a small chance that we can see lymph nodes develop. And
ultimately, it's this cancer that if caught early and treated, it's survivable.
So that's the great news about testicular cancer. If you can say there is great news about any cancer, it's a real success story for a lot of patients. It is a very curable condition, and it is definitely, the cure rates are related to how early it's caught or how, the early stage that it's detected in. So for patients who have, for example, low-stage seminoma or even non-seminoma, 90+% of these patients are going to be alive at 5 and 10 years with no cancer. It's the patients that present with, spread to multiple organs that have a lower survival rate, and obviously that's a more advanced stage. But even those patients will have, between 70 and 80% survival rate. So, particularly with the use of chemotherapy, some of the platinum-based agents, it has really transformed the success of treatment for testicular cancer, and I think it's a real success story for medical therapy.
Absolutely. That's great news. Listen, Dr. Van Appledorn, your information has been extremely helpful, particularly from my standpoint, just listening to you. I learned a lot, and I'm glad we had a chance to talk about something that's not real comfortable, and it is the end of Men's Health Month. How would someone get a hold of you if they needed to talk to you about, a urology question or needed to get checked up?
Well, certainly, I'm Scott Van Appledorn at Washington Urology, and we have offices in Bellevue and Kirkland, and our office phone number is 425-899-5800. We also have a website at washingtonurology.com, and I work out of Evergreen Hospital primarily, and we have an excellent cancer care center that's part of the Seattle Cancer Care Alliance, and that's also a good site for information, as well as to see some great providers if needed.
Excellent. Thank you again for your time.
My pleasure. Thanks for having me.
If you'd like more information on this topic, as well as how to contact Dr. Scott Van Appledorn, go to evergreenhealth.com or